Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today I want to answer a common question that comes up, and that is, how long can you have a pinched nerve before it causes permanent nerve damage? And really the answer to this is similar to the answers, to a lot of other questions. It all depends on the person. It depends on the severity of the nerve compression. So nerve irritation can be, and mild compression can be considered, is a pinched nerve. Whereas very significant compression of the nerve is a pinched nerve. So it comes down to what degree of compression you have of the nerve, because that's going to destroy the nerve faster. The more compression, the more destruction, right? Makes sense, right? So the thing is like it depends on how bad the compression is. Usually the worse the nerve compression, the more loss of function that you see. So if you have a pinched nerve and your leg's really weak and you have numbness and it goes all the way into the feet, that's a much more significant sign of compression than if you have, some nerve pain, but you still have normal muscle strength in the leg. You don't feel like when you walk that leg gets tired faster. You don't have a lot of change in sensation. You just have some pain into the leg. That's a different scenario. That's typically less neurological compression. But the main thing is that if you have those signs and symptoms, you need to be diagnosed properly and you need to be worked up properly. You may need an MRI, and a lot of times those types of symptoms do warrant an MRI to help us determine the severity and degree of your particular problem. And if it's severe, then you need a surgical consultation. That's the reality of the situation. We would help you find a surgeon to work with you. But if it's not as severe, then we would definitely could pursue some non-surgical therapies and therapeutic approaches. Do a trial anyway to see how you would respond. And if you do, fantastic. If not, then again, you're going to need to have a consultation with a surgeon. So I hope this helps you to understand, how permanent nerve damage is a real serious thing. We want to avoid that at all costs. So you've got to be worked up properly. If it's severe enough and we're seeing significant neurological loss of function, meaning muscle weakness, a lot of numbness, tingling, fatigue in the leg, then you're going to have to consult with a surgeon. So I hope this helps you to better understand. It's going to be different for every person. It's hard to tell, how quickly the nerve will be damaged. The more compression, the more risk there is. So I hope this helps you to better understand some of these not as simple, more complicated topics. If you have any questions, please don't hesitate to reach out to us. If you'd like an opinion on your case, on a pinched nerve that you may have, I'd be happy to take a look at you and let you know if I think I can help or if you need to see someone else. If you're interested in doing that, just give us a call. Our phone number is 828-324-0800. You can also find us online at hickoryspine.com if you want to learn a little bit more about what we do. But I appreciate you. Hope you have a wonderful day. Hope this has been helpful.